is primary healthcare. Primary healthcare as a concept was officially launched in the International Conference on Primary Healthcare that took place at Alma-Ata, the capital of the Soviet Republic of Kazakhstan, from September 6 to 12, 1978. This declaration was one of the first to promote the idea of health as a human right. It reiterated the realization that health involves far more than the health sector alone can accomplish, and called upon governments to build national plans for primary healthcare infrastructure. This ideal model of healthcare became a core concept of the World Health Organization's goal of health for all by the year 2000. The World Health Organization Alma-Ata Declaration of 1978 defined primary healthcare as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. Adopting primary healthcare has the following rationales: magnitude of health problems, increasing cost of medical care, inadequate and unequal distribution of health resources, and isolation of healthcare activities from other development activities. Primary healthcare has 4 cornerstones. The first cornerstone is equitable distribution. Health services must be shared equally by all people, irrespective of their ability to pay, and all must have access to health services. Primary healthcare aims to address the imbalance in healthcare by shifting the center of gravity from the cities, where a majority of the health budget is spent, to rural areas where a majority of the people live in most countries. The second cornerstone is community participation. There must be a continuing effort to secure meaningful involvement of the community in the planning, implementation, and maintenance of health services, beside maximum reliance on local resources such as manpower, money, and materials. The third cornerstone is intersectoral coordination. Primary healthcare involves, in addition to the health sector, all related sectors and aspects of national and community development. In particular, is agriculture, animal husbandry, food, industry, education, housing, public works, communication, and other sectors. The last cornerstone is appropriate technology. Appropriate technology is technology that is scientifically sound, adaptable to local needs, acceptable for those who apply it and for those for whom it is used, and can be maintained by the people themselves in keeping with the principle of self-reliance with the resources the community and the country can afford. Primary healthcare needs to be delivered close to the people, thus should rely on maximum use of both lay and professional healthcare practitioners, and includes the following 8 essential components. Public education is the first and one of the most essential components of primary healthcare. By educating the public on the prevention and control of health problems and encouraging participation, the World Health Organization works to keep disease from spreading on a personal level. It promotes the partnership of both family members and health workers in the promotion of health as well as the prevention of illness. Promotion of food supply and proper nutrition. Nutrition is another essential component of healthcare. The World Health Organization works to prevent malnutrition and starvation and to prevent many diseases and afflictions. There are many food resources found in the communities, but because of the faulty preparation and lack of knowledge regarding proper food planning, malnutrition is one of the problems that we have in the country. Clean water and sanitation. A supply of clean, safe drinking water and basic sanitation measures regarding trash, sewage, and water cleanliness can significantly improve the health of a population, reducing and even eliminating many preventable diseases. Maternal and child health care. Ensuring comprehensive and adequate health care to children and to mothers, both expecting and otherwise, is another essential element of primary health care. By caring for those who are at the greatest risk of health problems, the World Health Organization helps future generations have a chance to thrive. Sometimes, care for these individuals involves adequate counseling on family planning. The goal of family planning includes the spacing of children and responsible parenthood. Immunization. By administering global immunizations, the World Health Organization works to wipe out major infectious diseases, greatly improving overall health globally. This program exists to control the occurrence of preventable illnesses, especially of children below 6 years old. Immunizations on poliomyelitis, measles, tetanus, diphtheria, and other preventable diseases are given for free by the government and ongoing programs of the Department of Health. Local disease control. Prevention and control of locally endemic diseases is critical to promoting primary healthcare in a population. Many diseases vary based on location. Taking these diseases into account and initiating measures to prevent them are key factors in efforts to reduce morbidity rates. Examples of these are malaria control and schistosomiasis control. Accessible treatment. Another important component of primary healthcare is access to appropriate medical care for the treatment of diseases and injuries. By treating disease and injury right away, caregivers can help avoid complications and the expense of later more extensive medical treatment. The diseases that spread through direct contact pose a great risk to those who can be infected. Tuberculosis is one of the communicable diseases that continuously occupies the top 10 causes of death. Most communicable diseases are also preventable. The government focuses on the prevention, control, and treatment of these illnesses. Drug provision. By providing essential drugs to those who need them, such as antibiotics to those with infections, caregivers can help prevent disease from escalating. This makes the community safer as there is less chance for diseases to be passed along. This focuses on the information campaign on the utilization and acquisition of drugs. In response to this campaign, the Generic Act of the Philippines was enacted. Primary healthcare in the Philippines. Health reform initiatives in the Philippines began during martial law. Letter of Instructions number 949 was signed by then-President Ferdinand Marcos on October 19, 1979, 1 year after the declaration of Alma-Ata. It mandated the Ministry of Health to adopt public healthcare as an approach towards design, development, and implementation of programs which focus on health development at the community level. After 3 years, Executive Order number 851 was also signed by President Ferdinand Marcos on December 2, 1982. Integration of the promotive, preventive, curative, and rehabilitative components of healthcare delivery accomplished to ensure adequate health services for the entire population. The Generics Act was adopted in 1988 to ensure adequate supply, distribution, and use of generics, thereby improving access to affordable drugs and medicines. The National Health Insurance Act of 1995, or Republic Act 9875, aims to provide all citizens a mechanism for financial protection with priority given to the poor. It created the National Health Insurance Program, which shall provide health insurance coverage and ensure affordable, acceptable, available, and accessible health services for all citizens of the Philippines. The concept of primary healthcare according to the Philippine Department of Health. Primary healthcare is characterized by the partnership and empowerment of the people that shall permeate as a core strategy in the effective provision of essential health services that is community-based, accessible, acceptable, and sustainable at a cost which the community and the government can afford. With the goal of health for all Filipinos by the year 2000 and health in the hands of the people by the year 2020, an improved state of health and quality of life for all people attained through self-reliance. The functions of primary healthcare are: first is to provide continuous and comprehensive care. Second is to refer to specialists and/or hospital services. Third is to coordinate health services for the patient. Fourth is to guide the patient within the network of social welfare and public health services. And fifth is to provide the best possible health and social services in the light of economic consideration. The 3 levels of healthcare facilities. The primary level is the first level of contact between the individual and the health system. It is therefore closest to the people, where essential healthcare is provided and a majority of prevailing health problems can be satisfactorily managed. This includes barangay health stations, rural health units and their subcenters, private practitioners, community hospitals, and health centers. The secondary level is the smaller, non-departmentalized hospitals, including emergency and regional hospitals, and is the first referral level. Services offered to patients with symptomatic stages of disease which require moderately specialized knowledge and technical resources for adequate treatment. This includes emergency district hospitals, provincial and city hospitals, provincial and city health services. The tertiary level is the highly technological and sophisticated services offered by medical centers and large hospitals. These are the specialized national hospitals or regional medical centers. Services rendered at this level are for clients afflicted with diseases which seriously threaten their health and which require highly technical and specialized knowledge, facilities, and personnel to treat effectively. The types of public healthcare workers. Barangay health workers are the first contacts of the community and the initial links of healthcare. They provide simple, curative, and preventive healthcare measures, promoting a healthy environment. They participate in activities geared towards the improvement of the socio-economic level of the community, like the food production program. These include trained community health workers or health auxiliary volunteers, or traditional birth attendants or healers. Intermediate level primary health workers represent the first source of professional healthcare. They attend to health problems beyond the competence of village workers and provide support to frontline health workers in terms of supervision, training, supplies, and services. These include medical practitioners, public health nurses, rural sanitary inspectors, and midwives. Line hospital personnel provide backup health services for cases that require hospitalization. They establish close contact with intermediate level health workers or village health workers. These include physicians with specialty, nurses, dentists, pharmacists, and other health professionals.